Welcome to this educational video about lenticonus, a rare eye condition affecting the lens. We'll explore what lenticonus is, its causes, how it develops, and the available treatment options. Join us as we delve into the intricacies of this fascinating and visually impactful condition. The exact cause of lenticonus is not fully understood, but it's generally believed to be related to a weakening of the lens capsule. This weakening can be congenital, meaning it's present at birth, or it can be acquired later in life. Congenital lenticonus is often associated with genetic disorders like Alport syndrome, a condition that affects the kidneys, hearing, and eyes. Acquired lenticonus can sometimes link to eye trauma or other underlying eye conditions. Lenticonus develops when there's a thinning or weakening in a specific area of the lens capsule, the clear membrane that surrounds the lens. This weakened area bulges outward, creating a cone-shaped protrusion on either the anterior front or posterior back surface of the lens. This abnormal shape of the lens disrupts the normal passage of light to the retina, leading to visual distortion. The degree of visual impairment depends on the size and location of the lenticonus. Lenticonus is a relatively rare condition. The precise prevalence is difficult to determine, as many cases may go undiagnosed. Congenital lenticonus is more common in individuals with Alport syndrome. Acquired lenticonus is even rarer and often associated with specific predisposing factors. It affects both genders equally and can manifest at any age, though congenital forms typically present in childhood. The signs and symptoms of lenticonus vary depending on the severity and location of the cone-shaped protrusion. Common symptoms include blurred vision, distortion of images, decreased visual acuity, and increased sensitivity to light, also known as photophobia. Some individuals may also experience double vision or monocular polyopia, where they see multiple images with one eye. In severe cases, the lenticonus can progress to cataract formation, further impacting vision. Diagnosing lenticonus typically involves a comprehensive eye examination by an ophthalmologist. This examination includes assessing visual acuity, performing a refraction to determine the degree of refractive error, and carefully examining the lens with a slit lamp biomicroscope. The slit lamp allows the doctor to visualize the characteristic cone-shaped protrusion on the lens surface. Additional diagnostic tools like optical coherence tomography, or OCT, can provide detailed cross-sectional images of the lens and accurately measure the extent of the lenticonus. Retinoscopy can also reveal a characteristic oil droplet reflex in lenticonus cases. Lenticonus is primarily classified based on the location of the cone-shaped protrusion anterior lenticonus, where the cone is on the front surface of the lens, and posterior lenticonus, where the cone is on the back surface. Anterior lenticonus is more common and often associated with Alport syndrome. Posterior lenticonus is less frequent and may be harder to diagnose. Further sub-classification can be based on the size and severity of the protrusion. The treatment for lenticonus depends on the severity of the visual impairment. In mild cases, corrective lenses like glasses or contact lenses may be sufficient to improve vision. However, as the lenticonus progresses, vision may become significantly impaired, requiring surgical intervention. The primary surgical treatment is lensectomy, which involves removing the affected lens and replacing it with an artificial lens, or intraocular lens IOL. The choice of IO and surgical technique depends on individual factors, such as age and the overall health of the eye. In pediatric cases, amblyopia management or treatment for lazy eye is crucial following surgery. Currently, there is no known way to prevent congenital lenticonus, as it is often associated with genetic factors. Genetic counseling may be beneficial for families with a history of Alport syndrome. Protecting the eyes from trauma can potentially reduce the risk of acquired lenticonus. Regular eye exams are crucial for early detection and management of any developing eye conditions. The prognosis for individuals with lenticonus varies depending on the severity of the condition and the effectiveness of treatment. With appropriate management, including corrective lenses and surgical intervention, when necessary, many individuals can achieve good visual outcomes. Recent research is focusing on improving surgical techniques and developing more advanced intraocular lenses to further enhance visual rehabilitation. Gene therapies targeted at Alport syndrome are also being explored as a potential future treatment avenue. Continued advancements in ophthalmic technology offer hope for improved outcomes for individuals with lenticonus.